Hello.
Ayan na. Sorry mama, nag-ihi pa ako.
Sige lang, no problem. Let's just wait for Miss Lani and Miss Joy.
Sige po.
Lani.
Hello.
Ayan po. Hello.
Ayan na si Ma'am Lani.
Sorry, CR. Ayun, saan na ba tayo? Sorry, ganun eh.
Continue. Wait lang, eto na. Ayan, ma'am.
Yung binaba, yun, infectious waste. Basahin ko na po.
Yes po.
Infectious waste contaminated with blood and other bodily fluids. Example from discarded diagnostic samples. Cultures and stocks of infectious agents from laboratory work. Example, waste from the autopsies and infected animals from laboratories. Or waste from patients with infections. Example, swabs, bandages, and disposable medical devices.
Alright, thank you po. So, infectious waste mostly goes with the yellow plastic bag or yellow beans. Ma'am Lani, may question ako sa'yo, ma'am. Ito na last time kay Sir Marlon. So, if your patient, yung diaper ng pasyente po, saan siya itatapon? Let's say, may blood, may bowel movement dun sa nappy or urine. Saan mo siya tatapon, ma'am? Sa general waste or
sa infectious waste po.
Bakit po?
Kasi meron siyang, ma'am, hindi masyado narinig, pero parang meron, parang,
Go, Ma'am Lani.
Disposable na mga medical devices yun, di ba?
Okay. So, ang, tanong natin, Sir Marlon, kung naaalala mo pa yung discussion natin last time, saan mo itatapon yung
general, ma'am.
infectious?
Po.
Saan po?
General, ma'am.
Bakit po sa general?
Kasi siya, since biodegradable yung and then siya, ano pa ba ito? Ano yung explanation mo, ma'am? Nakalimutan ko. Sa general waste. Basta general waste yung naalala ko.
General waste. Sige, explain ko po ulit It's
sige
like
po.
Domestic waste. Di ba yung mga diaper ng baby, tinatapon natin siya sa general waste lang din. But, there's a but. There's a big but. If the patient is infected, like GI infection, it will go into the infectious waste. Especially kung meron silang tinatawag na C. diff, yun yung mga type of infection na galing sa gut, na napapass through the feces, it will be disposed to an infectious waste bin. Clear po tayo doon?
Opo, ma'am.
So, sa infectious siya, di ba?
So, infectious siya if infected. If not, it will go into
if not,
general waste. Just like the diaper of our babies at home. Iba sa general lang tinatapon.
Oo, ma'am. Yun yung example mo last time.
Ano pa?
Yun yung example mo last time.
Yes. So, if
kaya
the
naalala ko yung general waste.
Infection, itatapon natin siya sa infectious waste.
Infectious waste.
Yeah. And FYI po, ang infectious waste, just for your knowledge and information, mahal yan. Kasi wini-weigh yan for proper disposal. Lalo sa hospital, lahat ng infectious waste is collected and paid per weight. Kaya sa hospital, sila, kasi mahal ang binabayad ng facility for the processing of
Mm-mm.
our infectious waste kasi by weight yan. Kapag kinuha yan,
Kasi,
kinulit yan, it will be paid
Mm-mm.
by weight. Okay po?
Okay po.
kasi delikado nga naman.
Yes.
Oo.
Yung
Kasi,
processing niyan, kung paano siya dispose yan. Next is chemical waste. This is any solid, liquid, or gaseous waste material that is improperly managed or disposed may pose substantial hazard to human health and environment. So from the name itself, chemical. And then next is radioactive waste. So medical radioactive waste includes waste generated by nuclear medicine, radiation, oncology, and PET. So usually yung mga patient natin na with cancer, if they have ongoing oncology treatment, lahat ng diaper nila, ito pa po pala example, if the patient is on oncology treatment, they're having radiation treatment, yung diaper nila or yung waste nila, it will not go sa general, it will not go sa
to infectious. Sa
infectious,
radioactive waste siya.
radioactive.
Okay.
Like ito yung may mga cancer, di ba?
Kasi there's a specific time span wherein yung urine nila or lahat na lumalabas sa katawan nila is may radiation pa. So you have to consider that also, okay? So,
Okay po.
natin is on radiation therapy. Lahat ng waste nila, hindi siya sa general, hindi siya sa infectious, it will
Infectious
go to radioactive waste.
to radioactive waste.
So yun yung mga special considerations natin.
Okay po.
Now, we will discuss this one, Sir Marlon, no last time sa may infection control. Hindi natin
Yes
ito
po.
pero this is important part also. So
Okay.
so if magkakaroon tayo ng blood spill or body fluid spill, we have this called blood spill kit. So this kit is used for cleaning and disinfecting sites where blood has been spilled, as well as providing biohazard container for the safe disposal of blood or body fluid related contaminants. So ito siya. Kita niyo po yung picture.
Ayan pa.
Para
Ayan,
meron siya yung kit niya.
Wala pa pong picture.
Ano pa?
Ayan po, kita ko na Ma'am Lani.
Ito yung pipilit.
Yan mo lang siya, imumove mo lang
Ayun,
siya.
ayun. Apa. Nakita ko na.
Ayan. Ayan.
So generally, ang content niya is gloves, mask or safety shield, apron, powder, shovel, wipes, biohazard bag,
Right.
disposable towel. So like if there would be like medyo maraming amount ng blood na we are using this one to clean it. So how do we use it? Kasi yung content niya may powder siya. Ngayon, yung 'di ba yung na-spill yung blood sa floor, kapag pinur natin yung powder, magfo-form siya into gel para ma-absorb niya.
Para
Tas
madaling
into gel. And then once it's already been formed, may kasama siyang shovel. So, i-ano natin siya, ko-collect natin siya, and we will put it on the biohazard bag. May small yellow bag siyang kasama sa loob ng kit. So, lalagay natin siya, pati yung shovel, itatapon nyo na. And then yung kasama na wipe, yun yung ipang cleanse natin nung pinagkuhanan natin nung ano.
Naiwan.
Yes. Yun yung pang ano natin, for disposable towel. And then again, yung small na yellow bag, itatapon natin siya saan natin siya tatapon?
Infectious.
Correct. May question po tayo dito.
Wala po, ma'am.
Okay. Sharp management. So what is sharp waste, Sir Marlon?
Sharp waste is a form of biomedical waste composed of used sharps, which includes any device or object used to puncture or lacerate the skin. Sharps waste is classified as biohazardous waste and must be carefully handled.
Yes. So everything na makaka-puncture or lacerate ng skin is considered sharp. And we have to very careful when handling our sharps. So we have sharp container. Sharp container is a hard plastic container that is used to safely dispose hypodermic needles and other sharp medical instruments. So they're often sealable and self-locking, as well as rigid, which prevent waste from penetrating or damaging the sides of the container. So yan po siya. Yan yung mga example natin. It comes with different sizes. So sa bahay, usually ito yung ginagamit or sa mga clinics. Sa Pinas, may na-encounter na ba kayo sa Pinas ng mga nag-i-insulin, yung mga ganon? Ginagamit nila, di ba, is yung, anong tawag dito? Yung sa may water bottle.
Mm.
Doon nila dinilis yung yung mga needles nila.
Oo,
Pero, ito
ma'am.
yung proper sharp containers natin. Kasi yung plastic bottle, like this one, very siya, di ba, manipis siya, tapos soft,
pwedeng mabutas.
na ma-puncture siya, palabas. So, yun yung iniiwasan natin. So, we advise the use of the proper sharp containers. And again, so, sa proper handling natin ng sharps or disposal, medyo expensive din siya. Kasi parang ini-incinerate ata nila yung mga needles. Kaya medyo costly din siya. So let's move to prevention of needle stick injury. Ma'am Lani?
Avoid recapping needles. Before beginning any procedure using needles, plan for safe handling and proper disposal. Use devices with safety features. Report all needle stick and other sharps-related injuries. Dispose of used needles in appropriate sharps disposal containers. Participate in blood-borne pathogen training and follow recommended infection prevention practices, including hepatitis B vaccination.
Thank you. So these are the ways on how we can prevent needle stick injuries or needle prick injuries. So avoid recapping if like you will give an insulin to your patient, if you will do blood, what do you call this one? Glucometer for checking the blood sugar. So we're using still fine needles for that. So do not recap. Ibig sabihin, huwag natin ibalik yung yung cap ng needle. Very prone for needle prick injuries or needle stick injuries. Before beginning any procedure, make sure that you plan handling and proper disposal. So everything should be there kapag gumawa kayo ng procedure sa patient. Like if you don't have the sharp, what do you call this one? Sharp bean, at least you have something na pwede nyo ilagay yung yung sharp ninyo. And then go with. Huwag nyo siyang, don't practice na yung needle hawak-hawak nyo hanggang makarating kayo sa sharp bean ninyo. Don't do that. Kasi baka mamaya madapa
Dapat nasa malapit lang.
Matusok ka, nako, delikado. So, if you don't have it in your bedside or near to you, at least bring something kung saan siya pwedeng ilagay and then dispose it properly.
Okay.
And then reporting, very important. Report it immediately. Hindi pwedeng makakalimutan nyo siya. And dispose it in appropriate sharp disposal container and participate in bloodborne pathogen training and follow recommendations as per infection prevention practices. So, kailangan meron tayo nitong Hepa B vaccine. Meron ka, Ma'am Lani?
Dati. Oo. Meron. Kailan ba yun?
Especially if mag-duty na kayo or mag-start na kayo mag-duty sa patient ninyo. Make sure na active pa siya. Meron tayong tinatawag na titer.
Titer.
So, yes. Accept natin si Miss Joy.
Ma'am, ilang yung validity ng yung Hepa B
actually,
vaccination?
Depende siya sa level ng titer ninyo. So, there's a test kukuhanan kayo ng blood, tapos doon makikita yung level ng HEPA-V. And then,
Mm,
from there, i-recommend nila kayo if kailangan nyo magpa-booster shot.
okay.
So, alam ko tatlo siya eh. Tatlong
3.
injection shot.
3
So, pag
booster.
na-complete yung tatlo, booster na lang yung kailangan ninyo. So, para malaman
Mm,
kailangan nyo ng booster, you have to do the titer.
okay.
Para malaman yung level if enough pa siya to cover you or to protect you.
Mm,
Okay po?
okay.
Make sure kapag bago tayo mag-duty or bago tayo ma-expose sa bedside, just make sure that you are covered and you are protected with your immunity. Okay po?
Okay po.
Okay po.
Next. These are the steps to take following a needle stick injury. So wash wound with soap and water. Report the incident to your line manager or supervisor. Immediately seek medical treatment at the nearest ER or treatment facility. So ito na yung first aid actually, yung washing natin with soap and water.
Mm.
So why do you think we need to seek immediate medical attention?
Para hindi,
Again, ma'am?
if meron man bacteria at least maano agad, di ba?
Yes, correct. So if we are na-injured tayo, di ba? First thing that we will do, wash it with soap and water. Then we will call our supervisor to inform that we were exposed. So yung immediate medical attention or treatment, this is very important because they will take blood samples for our baseline serology.
Mm.
And also, tingnan din nila yung pasyente na naka-prick sa atin. It depends on the regulation of the facility. Especially, like, pwede kasing mag-refuse yung patient na hindi sila magpapatake ng blood. So, they can give us a prophylactic dose of prophylactic injection para sa mga blood-borne diseases. So, yun yung importance ng seeking immediate medical treatment. Para meron tayong baseline sa serology natin.
Okay po.
Pero dapat make sure na hindi natin to gagawin. I mean, hindi tayo aabot dito.
Hindi mangyari. Oo.
Oh,
So, just always protect yourself. As in, iwasan nyo yan. Ako naman, parang thank God, for my whole practice, never pa ako na-involve sa ganito. So, always consider, ito nga yung lagi namin sinasabi, always consider them positive.
Safety.
Para mas cautious kayo, di ba? Sa pag-handle ng mga needle. Kasi, lalo na yan, bloodborne yan. So, pag nag-positive kayo dyan, mahirap na makabalik sa profession. So, always take care. Alright?
Okay po.
Okay po.
Next is food preparation. This is also included in housekeeping. This includes a set of practices involved in acquiring raw ingredients and transforming them into something ready to be consumed. It's very important to prepare food safely to help stop harmful bacteria from spreading and growing. So, like our bed making, we have one topic focusing on food preparation. Kasi, di ba, syempre, our patients, they can be diabetic, they can be like cardiac patient. So, there's a specific diet for a specific patient. Hindi siya general. So, meron tayong week only to focus on food preparation. So, this is again just general overview in relation with housekeeping.
Opo.
So, what is food hygiene po, Sir Marlon?
Food hygiene is a scientific approach to the handling, preparation, cooking, storage, and serving of food to prevent foodborne illness. Such illness are the result of the contamination by harmful bacteria or viruses. Contamination usually occurs because of lapses in food hygiene techniques.
Okay. May question po ba tayo dito sa meaning natin ng food hygiene?
Food hygiene.
Wala naman po.
Wala naman pa, ma'am.
So just make sure that we are properly handling our food kasi there's like infection that can be acquired through mishandling of the food. So there are 4 C's of food safety. First one is cleaning. Making sure that clean kitchen surfaces after preparing foods. Try to do clean as you go. After handling raw meat, poultry, fish, and other raw foods, always wash hands, utensils, and surfaces thoroughly and before any contact with other foods, especially cooked and ready to eat. So we should always observe cleanliness. Pwede kasing hindi tayo magpe-prepare directly or ng food nila, tama? But like from the
Yes.
kitchen, ibibigay sa atin, we should observe cleanliness, especially when giving it to our patients. Next is cooking,
Number 2 is cooking. Follow recipes and label instructions on cooking times and temperatures. Don't cook foods too far in advance. Once cooked, keep foods covered and piping hot until it's time to eat them. When using the microwave, stir foods and drinks and allow them to stand for a couple of minutes to avoid hot or cold spots.
Alright, thank you po. So, napansin nyo ba sa hospitals, like kapag magbibigay na sila ng food, di ba nakalagay siya dun sa parang malaki na tray, yung tinutulak kasi it regulates the temperature of the food. So, before serving it to the patient, nasa tamang temperature siya. That's why whenever it will go out from that trolley, they advise it to be eaten right away. Hindi siya pwede bedside. Kailangan siya ma-consume agad. Kasi baka nga masira siya, right? Especially if they're using fresh materials or ingredients. Next is cross-contamination. So, food poisoning, is often caused when harmful bacteria on one food are spread via hands or kitchen utensils to cross-contaminate other food. So, always hand hygiene. So, hand washing or hand rub, especially if we are handling or dealing with food. Keep raw food separate from cooked and ready-to-eat food at all times. Ideally, use separate chopping boards for raw and cooked food. Wash hands after handling raw food and before touching other foods and utensils. So always do hand hygiene, hand washing and hand rubbing. And then chilling. Do not put hot food directly into the fridge or freezer. Let it cool sufficiently first, but remember that cooling should be completed within 1 hour or 2 hours after cooking. To speed boiling, divide food into smaller portions, place in a wide dish, and stand this in a shallow tray or cold water. So after cooking, we're not directly putting it in the fridge, right? So we let it cool down first. But just to always consider that it should not stand for more than 2 hours. Kailangan na siyang i-rep. Alright. So, ito yung sa food handling. But not all patients are eating. Correct?
Yes po.
Some patients are having enteral feeds. Enteral means through tube. So, it can be nasogastric tube or head tube. Head tube is yung button sa tummy. Nakadirect na siya sa tiyan. So, food safety is not limited to food per se. So, it's also with handling of milk. So kapag syempre magbibigay tayo ng milk sa pasyente, we also have to consider or practice food safety. So the expiry, how long it can stand from opening, or how long it can stand after the preparation. So we have to consider those things. Okay po?
Okay po.
Now let's go to care of equipment. Sir Marlon.
Equipment must be decontaminated according to evidence-based protocols to minimize patients' risk of healthcare acquired infections. Routine decontamination of reusable non-invasive care equipment must be done according to manufacturers' instructions on using suitable cleaning products that are in line with local policy. And then it should be undertaken below, like bit to, ano to ma'am, basahin ko na lahat.
Basahin mo na pala.
Between each
Uh,
use.
Between each use after blood or body fluid or other visible contamination at regular predefined intervals as part of an equipment cleaning protocol and before inspection, serving or repair.
Okay po, thank you. So, care of our equipment. So, it is our responsibility as a caregiver to clean our equipment. So, if it's in a facility or hospital setup, each equipment must be cleaned between each use because it is shared by a group of patients, tama po? But if
Opo.
you will be assigned in a home care setting, kailangan pa rin natin siyang regularly i-clean.
Linisin.
So, syempre,
Mhm.
solo yan ang pasyente nyo. So, it should be cleaned if it's visibly soiled or contaminated with blood or any other body fluid. Or if it's regular predefined intervals, so there should be like set dates when to clean it or before inspection, servicing, or repair. So, before natin siya ilabas for servicing, kailangan natin siyang linisin para if ever kung ano mang meron doon, safe naman yung mag-i-inspect ng ating equipment. Okay po?
Okay po ma'am.
Yes, ma'am.
So, what are the principles of decontamination? Ma'am Lani po.
The level of the contamination required depends on the level of risk associated with the item. There are 3 levels of decontamination for care equipment. Number 1 is cleaning, thorough cleaning with water and a neutral detergent or disposable detergent wipes to remove substances such as dust, soiling, and organic matter, along with the large proportion of microorganisms. The first and most important step in any decontamination process. Public Agency 2011. Then,
Okay, ma'am. Thank you po.
Nana,
So, cleaning. So, just using with the soap and water or other neutral detergents. So, yan po yung ating number 1 decontamination process. So, number 2, disinfection. Sir Marlon?
Disinfection, use of heat or chemicals after cleaning items known to be suspected of being contaminated with blood or body fluids in contact with mucous membranes used by a patient with a known suspected infection or colonization with organisms such as D. difficile. What is this?
Difficile, yeah.
Yeah, and multi-drug resistant bacteria as specified in local protocols. Health Protection Scotland 2015 to reduce the number of viable microorganisms to a level that is not harmful to health.
Okay, thank you, sir. So,
Mm-mm.
disinfection, di ba kanina yung cleaning, we're just using soap and water,
detergent.
right?
Yeah.
And detergents. With
Disinfection.
disinfection, we are using heat or chemicals to
Chemical.
disinfect or sorry, to clean or decontaminate the equipment. Especially this C. difficile. Parati ko siyang na-mention. Kasi mahirap siyang i-eradicate. There's a study na hindi enough yung alcohol to kill the C. difficile. So, kailangan talaga siyang hand washing yung sa C. difficile. And there's a specific cleanser para na ginagamit for surfaces if the patient has a C. diff or positive with C. diff. And then the next one is sterilization. This use of heat or some chemicals may sterilize in specific, highly controlled system to render objects free from viable microorganisms, including bacteria, spores, and viruses, used to decontaminate high-risk items, including reusable invasive equipment such as surgical equipment. So, sterilization. So, yun ilalagay natin sa ano, diba? Dun sa may, ano tawag doon? Yung pang-sterilize na, ano, na machine, it uses a certain level of heat to reach that level of decontamination. So, that's it. Now, let's discuss how to clean hospital bed and mattresses. Di ba remember kanina yung bed making? Kapag
Opo.
bed making tayo, pag tinanggal natin yung linens, kailangan nating i-disinfect yung bed itself. Hindi lang siya tatanggal ng linen and lalagay ng bagong linen. So we have to clean also our bed and mattresses. So these are the steps on how to clean a hospital bed and mattress. Readable po ba siya sa inyo?
Opo, ma'am.
Apo, nilakihan.
Okay.
Isusum lang.
Alam ko na ngayon.
Alam mo na, Ma'am Lani?
Oo, dati hirap na hirap ako eh. Pwede mo palang i-zoom.
I-zoom.
Opo.
Tama. So first po, of course, wash our hands, put apron and pair of gloves. So don't touch anything with your bare hands. Always, for safety
Bare
purposes, use our gloves. Especially if we are doing bed making, it is soiled. Tama? Kasi ginamit na yun ng pasyente eh. Even it's not
Opo.
physically soiled, still consider it as soiled. So you have to use your gloves. So if not using a disposable wipes, prepare the cleaning solution in a bucket according to the manufacturer's guideline and place the bucket on a cleaning trolley. Syempre ngayon medyo convenient na yung mga gamit. Meron na tayo mga Cleanel wipes. Meron tayong, anong tawag doon? Yung spray na nabibili lang sa market. Ano ang tawag doon? Sorry. Dettol. Diba?
Okay.
Dettol na spray. So we can use it. So raise or lower the bed to a convenient height. Kasi di ba yung bed na-adjust siya. So always observe proper body mechanics para yung back natin hindi sasakit. So put it on a level na convenient sa inyo. Then remove any item from the bed frame and put them in a safe place. If damp, dusting, dampen or rinse the cloth in a cleaning solution. If using detergent wipe, take a wipe from a container. Then clean from top to bottom, working downward to the base and wheels. If damp dusting, turn the cloth regularly and rinse regularly in a cleaning solution. Change the cleaning solution when it becomes soiled. If using wipes, replace the wipes when they become dry or soiled. So remember, from top to bottom tayo kasi ang top is considered clean. Then going tayo sa baba na dirty. So, kapag natapos na natin, huwag nyo na siyang babalikan. Kasi makakontaminate nyo na yung area na nalinis na ninyo. And especially if we are using Cleanel, do you have any idea po ba sa Cleanel?
Ano po?
Cleanel.
Cleanel?
Hindi po. Wala po.
Para siyang baby wipes.
Okay.
Pero this one is surface disinfection and cleaning of non-invasive medical devices. So kapag ito.
Ano ko na yung sa nurse namin sa school.
So ano siya, damp yung ano niya, basa siya with para siyang may soap sud. So pag ginamit natin siya, pwede natin siyang gamitin hanggang ma-dry up siya. Then dispose, then get another one for cleaning. So if we are using like what do you call it? Yung cloth na pang cleanse, example yung Dettol spray. So we have to make sure that we are regularly turning it or ano siya, anong tawag doon? Yung inaano natin yung mga ano niya. Oh, I forgot the term. Yung hindi lang siya yung isang surface, tapos babalik na rin natin siya. And then if we are using water with detergent, we have to rinse the wipes or the cloth. Okay po?
Okay po.
And then take care to clean the edges and undersides of surfaces after cleaning the tops. If cleaning the mattress, wipe the impermeable cover clean using a S-shaped motion and non-abrasive cloth. Turn the mattress and clean the underside, then clean all the edges. Change the cleaning solution and cloth when soiled or wipe when soiled or dried. Allow the mattress to dry and wipe all surfaces with disinfectant wipe. Next, when the bed frame is dry and the mattress is cleaned, replace any item that were removed before cleaning commences. Lower or raise the bed to its original position. Dispose the cloth or wipes and cleaning solution. Dry and clean the bucket according to local policy. Remove the apron and gloves and wash your hands. So this is the steps on how we clean our bed. So easy siya kapag yung pasyente natin is nasa mobile, yung kapag kaya umalis ng bed. So what if the patient is bed bound? How do we clean our bed?
Kapag po, ano?
Pag ano mo?
Kapag
If the
yung patient is bed bound or bedridden. Kasi this one is very easy if the patient can move out of the bed, correct? Alisin natin yung pasyente, clean natin yung bed, madali na siya.
Pagkakaalam ko, parang yan mo muna siya sa kabilang side, move mo. Lilinisin mo yung side na yun. Oo, tapos i-ano mo ulit. Pag natapos mo yung kabilang side, sa kabila naman.
Exactly, correct po si Miss Lani. So if our patient is bed bound, anyway, we will discuss it with moving and handling of the patient. Just to give you an idea on how to clean the hospital bed with the patient on it. So we will clean it by sides. So first, ito-turn natin si patient to his right side. Then we will clean the left side. Remove the linen and just push it towards the patient, and then we will clean the bed. And then we will put the new linen. Then we will turn the patient to the clean side, and then again we will do the same process on the other side. So we will discuss that one, and we will practice that one on moving and handling and also bed making. Kasi mas iba na siya kapag nandoon ang patient. Tama?
Actual.
Especially mga fragile na patient or yung malalaking patient. Imagine we have like 100 kilo or 150 kilos patient. How you will do that?
Bigat.
Parang sakto lang siya sa bed niya.
Ma'am Lani, kaya mo bang buhatin yan?
Huwag kayong magulat kasi it happened.
Hala?
Struggle is real. Kaya kailangan pa-practicein natin siya. So this is the illustration on how to clean the bed. Di ba kanina sabi yung S-shaped motion? So parang snake siya.